This presentation analyzes CVS Health through the business model canvas and then redesigns the model around a targeted innovation called CVS Care Navigator. I'm keeping the focus practical. CVS already has pharmacy access, Aetna, Caremark, care delivery assets, digital tools, and a huge customer base. The issue is that those pieces can still feel fragmented to the person trying to use the system. So the question is not, can CVS become a totally different company? The question is, can CVS turn the pieces it already owns into a clearer, more trusted, more useful healthcare experience? So the first section is the current business model. I'm using the business model canvas from Osterwalder and Pigner because it forces the analysis to be more than just a company overview. It looks at who CVS serves, what value it offers, and how it reaches customers, what resources it depends on, and how the company captures revenue. For CVS, that matters because the company is not just a pharmacy chain anymore. Its model is built around pharmacy, benefits, insurance, and care delivery working together. This slide shows the current CVS business model canvas. On the right side, CVS serves patients, consumers, Aetna members, employer clients, government payers, and pharmacy related clients. Its value proposition is convenience, pharmacy access, insurance coverage, medication support, and connected healthcare services. On the left side, the model depends on key partners like drug manufacturers, providers, employers, payers, and technology partners. The key resources are CVS's pharmacy footprint, Aetna, Caremark, health data, pharmacists, clinicians, and digital platforms. The revenue streams come from prescriptions, retail, insurance premiums, PBM services, specialty and mail pharmacy, and care delivery. The main point is that CVS has a wide model. The value is not in one block, the value is in whether these blocks work together cohesively. On the customer side, the current model is already broad. CVS is serving individual patients, Aetna members, employers, plan sponsors, government payers, and pharmacy related clients. The customer value is supposed to be convenience and connection. CVS can reach customers through stores, clinics, apps, websites, mail pharmacy, specialty pharmacy, and employer health plan channels. The issue is that the customer does not care that CVS has a lot of assets if the experience still feels confusing and fragmented. So the current model has strong reach, but the strategic question is whether CVS can make that reach feel simple and useful. On the operating side, CVS has a strong resource base. It has physical locations, pharmacists, clinicians, digital tools, Aetna, Caremark, and claims or benefits information that can support a more connected model. Using Rothermel's strategic logic, the potential advantage is not only that CVS has resources. The bigger question is whether the company is organized to use those resources in a way competitors cannot easily copy. If CVS's parts stay too separate, the model loses power. If the pieces are coordinated, the model becomes much harder to imitate. My diagnosis is that CVS's current model isn't weak. It has a lot of strong pieces, but that's also the problem, all of the pieces. A lot of the pieces can create a lot of confusion. The customer may not experience CVS as one connected healthcare company. They may experience a pharmacy, a health plan, a PBM, an app, a phone number, and a clinician as separate doors. That's the gap the revised model is trying to address. The goal is not to blow up the current model. The goal is to add a customer-facing integration layer that makes the model easier to use. The next section is the strategic innovation portion of this assignment. I used what-if thinking to test how CVS could redesign the model without drifting away from its real assets. The selected innovation is CVS Care Navigator, which is an AI-supported but human-escalated navigation layer for benefits, medication affordability, and care routing. For the what-if section, I used two scenarios. The first was, What if CVS stopped making customers move through separate pharmacy, benefits, and care touchpoints and instead gave them one clearer navigation experience? The second was, what if the model was sponsored through employer health plan clients instead of charging members directly? I selected CVS Care Navigator because it is close enough to CVS's current model to be realistic, but it still changes how value is delivered. The idea is not just another chatbot. The idea is a care navigation layer that connects the blocks of the current business model. This revised canvas shows how the model changes when CVS Care Navigator is added. The customer segments become more specific. Aetna members, chronic care patients, employer clients, people confused by benefits or medication costs, and current CVS pharmacy users. The value proposition becomes one clearer starting point for benefits, pharmacy support, care routing, and human escalation. The channels shift toward a shared CVS and Aetna digital hub, pharmacy touchpoints, app or text prompts, employer channels, and phone support. The key activities also change. CVS would need AI-supported navigation, affordability guidance, human handoff, and continuous model testing. So this is not just a new feature, it changes how the business model creates and delivers value. This slide shows the customer-facing changes by canvas block. The customer segments become more precise. The value proposition becomes clearer because the customer is not just getting a pharmacy or an insurance plan. They are getting a navigation experience. The channels become more connected, especially through digital and pharmacy touchpoints. The customer relationship becomes more proactive with reminders, guidance, and human escalation. The revenue model does not need to charge patients directly for every interaction. It can support the existing employer, plan, pharmacy, and care model by making members more likely to use the right services at the right time. On the operating side, the redesigned model requires more than software. CVS would need consent-based data rules, AI governance, training, cybersecurity, compliance review, and human support teams. That matters because healthcare AI cannot be treated like a regular recommendation engine. If the model gives people guidance about medication costs, benefits, or care routing, leadership has to make sure privacy, bias, and patient autonomy are built into the system. The revised model creates value, but it also creates increased responsibility. The strategic fit frameworks help explain why this model is not random. Through Ansoft, this is a product development because CVS will be offering a new navigation service to its current customer and employer base. Through BCG logic, Care Navigator is more like a question mark, meaning CVS should test it before scaling it. Through VRIO and the resource-based view, the AI tool by itself is not the advantage. Other companies can build AI. The advantage is CVS combining AI with its pharmacy footprint, Aetna, Caremark, care teams, and customer relationships. And through Miles and Snow, CVS is acting like an analyzer, protecting the core while selectively innovating. The biggest implementation issues are not technical. The first is trust. Healthcare data is sensitive, so CVS would need consent rules, privacy protections, bias review, and human escalation. The second is how it's presented within the organization. A model like this crosses pharmacy, Aetna, Caremark, digital teams, compliance, and care delivery. That means the launch cannot be owned by one isolated department. The third challenge is adoption. A business model can look clean on a canvas and still fail if employees do not understand it or customers do not find it useful. That is why I would recommend piloting it first and then using real feedback to revise it. My recommendations are to pilot, govern, and measure. First, CVS should not roll this out everywhere at once. Start with a defined group where the need is real, like members with complex prescriptions or chronic care needs. Second, build the governance before scaling the tool. In healthcare, trust is not something that can be cleaned up later. So privacy, bias, consent, and human escalation need to be an intricate part of the model from the very beginning. Third, CVS should measure actual value, not just engagement or technology usage. If the model does not reduce confusion, center the customer, or improve navigation, then leadership needs to revise it instead of forcing it. This section reflects on the process. The assignment asks what I learned about business model innovation and how AI tools affected the process. The short version is that AI helped me organize options, but it did not remove the need for judgment. The more sensitive the topic is, the more human judgment matters. AI helped most with organizing the canvas and generating what-if options. It was useful for asking if one part of the model changes, what else has to change? That is important because a business model is connected, but AI also had a lot of limits. Some ideas are too generic. Some sounded like adding technology just because technology is available. I had to narrow the model back to CVS's actual resources and the reality of healthcare. My biggest learning is that business model innovation is not just making something new. It has to be useful, ethical, practical, and aligned with what the company can actually execute. From a strategic leadership perspective, CVS leaders should not treat this as a simple app launch. This is an organizational action. It would need ownership across pharmacy, Aetna, Caremark, digital teams, care delivery, compliance, and frontline employees. The leadership competencies that matter are adaptability, systems thinking, innovation management, ethical foresight, and communication. Leaders would also have to manage resistance because people are used to working in their own lanes. The model asks different parts of CVS to move together cohesively. To keep the model evolving, leadership should create a review loop: pilot, measure, audit, revise, and only then should they scale. And because this is healthcare, leaders need character strengths like prudence, fairness, honesty, judgment, and leadership. The goal is not to just move fast, the goal is to innovate without losing trust, especially in a healthcare climate like the one we have here in the United States. This slide shows the leadership mechanism I would use to keep the model evolving. First, pilot the model. Second, measure whether it actually improves navigation and trust. Third, audit it for privacy, bias, safety, compliance, and human escalation. Fourth, revise it based on what we learn. Fifth, scale it only when the evidence supports it. That's important because business model innovation is not a one-time assignment. In a digital economy, the model has to keep changing as technology, customers, regulation, and competitors change. And these are my references.